This is the in-person meeting of the Board of Interpreters for the Deafblind and Hard of Hearing in Lansing, Michigan. That is also being live streamed and recorded. Thank you to the board members and the members of the public who are in attendance today and those joining us by Zoom. Before we get started, a few items I would like to go over. The agenda and Zoom information are posted on the Michigan Qualified Interpreter website found at michigan.gov/CHS. After the meeting, the approved minutes will also be posted to the website. The in-person board meeting and live stream are being provided with ASL and captioning. People with disabilities requiring additional accommodations to participate in the meeting can email Laura-BCHS-qualified-interpreter@michigan.gov. For the public comment part of the meeting, the in-person audience will give comments first, then those on Zoom. We are using the Zoom webinar platform and your video and audio are currently shut off. When it is time, participants on Zoom who wish to comment should type comments in the chat feature. If you wish to be on camera, click the icon at the bottom of the screen to raise your hand, and then we will recognize you and ask you to turn your video and audio on. Additionally, board members and department staff are not permitted to respond to public comments. Please limit public comments to around 3 minutes. Thank you again for joining today. I will now turn it over to department staff member Heather Keel to call the meeting to order.
This is Heather Keel. Good morning, everyone. It is 10:05 a.m. I will first go ahead with roll call and then read the communication policy. Mitch Halali. Here. April Davidson. Sarah Houston. Miriam Andrade Cuevas. Diana McKittrick is not present. James Check.
Here.
Rowan O'Doherty.
Here.
So with that, we do have a quorum. Next, I'm going to go ahead and read the communication policy. The communication policy states, the policy is proposed for the Board of Interpreters for the deaf, blind, and hard of hearing for visitors to facilitate successful discussion and debate during the meeting proceedings. It is intended that by following the policy, communication will be achieved for everyone present and will improve the effectiveness of the meeting. Board members should wait to be recognized by the chairperson to speak. The chairperson will recognize the speaker by name and allow for adequate discussion of all issues brought before the board. At any time during the meeting, if any board member or public attendee needs adjustment in communication facilitation, they should get the attention of the chair by raising their hand. All voice votes will be taken by raising of the hand. Avoid sidebar conversations. No comments from the public will be entertained during board discussion and should be held for the public comment section of the agenda. Board members are not permitted to respond to public comment, and public comments are limited to 3 minutes. With that, we will move on to agenda item number 3, approval of agenda. Can we get a motion?
This is James. I make a motion to change the agenda. Number 6, new business. Part C. Committee reports. The interpreter shortage investigation. I propose that we move that to number 5 under old business, not new business.
I will approve and second that motion. This is Sarah.
This is Mitch speaking. I move that we accept the agenda with the change.
I second that. This is Sarah. Call a vote. All in favor? Aye. Any nays? Motion passed for the amendment to the agenda. The next under new business, this is Sarah, is approval of the minutes from the October 16th meeting, number 4. Do I have a motion to approve those minutes? Okay, thank you, Colleen. We'll go back to old business. Okay, perfect.
Well, this is Mitch speaking. I make a motion to accept the minutes from the previous meeting, October 16th, 2024. 26, no, 24.
This is April. I second that motion. This is Sarah. All in favor? Aye. Any opposed? Nays? Any abstain?
This is Rowan, I abstain.
Thank you, Rowan. So that motion is passed. Okay, so the minutes have been approved from October 16th, 2024. Now we're moving on to old business regarding the subcommittee report. James, to you.
Thank you, Sarah. So let's help me remember clearly what we were talking about, the April meeting, or in the meeting in April last year. We had someone come up and make a public comment, and they were making comment about doesn't seem to be enough interpreters. There's this problem, that problem. He really encouraged us to do something. His phrase was do better in regards to that. So we took that to heart, and we agreed with that comment. We're aware that there is an interpreter shortage. It's hard to find interpreters. Many in the community, deaf, blind people say, hey, my appointment keeps getting moved, or it's getting canceled due to there being no interpreter, or I arrive, I think everything's good to go, and I'm waiting for an interpreter and they don't show up. So that's been happening frequently is what we hear. So we did establish a committee to look into that and do some investigation. And so our report is completed, and we sent that to BCHS. We have that also in a frozen text and in sign language. And so we've asked them, I know it was a kind of last minute before this meeting. We asked them, hey, can we get that printed out? Well, we didn't have time to do that before this meeting. I think I tried to email it. It's a conflict for me to try to email that to the board. I don't think I can do that. I have to ask them to please disseminate that to the board members so you have an opportunity to read that report. There's a few things I wanted to touch on, though, from those findings in the report. Was it, conclusive, comprehensive? Maybe not, but I contacted the Arizona Commission for the Deaf and Hard of Hearing. Cameo Hunsaker, talked with them, had a video conversation twice. State of Arizona recently printed their findings from their investigation, 2024. And we had that discussion. I also talked to Minnesota Registry of Interpreters for the Deaf, a survey that they did in their state in 2022, and then again in 2023. And the ones that ran that, we had a video conversation as well. And then here in Michigan, many agencies, individuals have been reaching out after that announcement, for discussion. And we've had some hearty discussions with those agencies, with interpreters. I have notes from their perspectives, their complaints, their concerns from those conversations. So we included that in this report. And so my first goal is to maybe give some explanation, not really, and announce some type of the partnership that we have maybe with Innovi and what they have going on. BCHS recently made that announcement that they will partner with Innovi Strategies. And so it means that they're going to do a more deep dive, extensive investigation into this interpreter shortage. The report from the committee that we've concluded, we decided to condense that into the, important topics, concerns that arose from that. For example, back in the beginning of, who wants to become an interpreter? How do you start? How do you start that process? How do interpreter training programs recruit? And then some information about that from that moment. Then, you graduate as an interpreter from a program. It seems that many support maybe a 2-year or a 4 years, saying that that's not enough for them to be ready to pass certification and be certified. So again, we put that in the report. We showed some dates. We put some information along with that so that we could show the agency. And hopefully when BCHS in their partnership with Innovi, when they see that and they go ahead and they start doing this analysis as well, that report will bear out some things as well that are important and help maybe lend themselves to some of the questions they're going to ask when they do their survey. And so we're going to ask them to kind of take the ball and continue with that more in-depth survey. So as far as a board, you're going to see that soon. I will be in touch with BCHS, community members who really have an interest and want to know what's going on, want to discuss that, want to look for things out in the field that they're curious about. That report will be made public and it'll be accessible. So I will have conversations with BCHS and try to work that out so that that can get disseminated, posted, or somehow sent out to everybody.
Thank you for that report, James. Mrs. Sarah? Moving on to new business. We are going to give it now is time for a partner update. Hearing none. Okay. We'll move on the agenda. And now we're going to do department updates. And Heather Hosey is here to present those updates for us.
Good morning, everyone. Get this right. Okay, everybody here? Okay. All right, Colleen, we can go to the next slide. I do want to start off with, not on the slides here, but introducing a few of our staff that attended today and are supporting some of the QI activities. So in the back row, we have Jason Schieneman. I don't know if you guys, can you just wave Jason so that you can see he's in charge of doing enforcement for our QIs if we have enforcement action. He was here last spring, maybe. So just stopping in today in case there's any questions or feedback for him. And then Andrea Moore, she is also in the back row. She oversees the long-term care section, so our nursing homes. We'd really like to encourage bridging the gap between healthcare and the QIs, and we hear that that's an area of concern. So Andrea's team oversees, like I said, nursing home licensure and complaint investigation. And then we have Beth Monsman. She was here last spring as well, and oversees, or she does the investigations and licensure activities for non-long-term care. So she goes to hospitals, psychiatric hospitals, sometimes surgery centers, things like that. And then we also have our workforce background, workforce investigation section here. We have Tina White, who supports the team. Also Jim Wiggins, who is the manager of the section. And lastly, John, who's with us, and he does the investigations. So he would be the ones doing investigations of the QIs if we have that. But he also does medication aids and nurse aids. So thank you all for coming today. And then Larry, do you want me, just everybody, so everybody knows Larry is here, our bureau director, and in attendance. All right, so things that have been going on over the past few months since we've seen you last. We are exploring some projects with DPAN. We do have a contract with them. So they're going to help us with anything that we need with production wise. I'm not sure if you guys are familiar with them, but they sound like they're pretty well known in the community, but we do have an agreement with them so that if we have any production things that we need to do, that we can do that with our projects. And then at the last meeting, I know we did not settle on dates for our upcoming board meetings. So Madonna University and Mott University are going to host, hopefully. We're just still ironing out those details. So hopefully we'll know some more soon. We are going to visit and be on site to see what works best for them. And then we know that in the past we've had troubles or heard feedback about the state emails with the board members. And so we are trying to make it more accessible and communication more accessible. So we did create a SharePoint site, which is more like a link that would be on a website so that we can share securely all of the information that we need between board members and the department. And I think we updated in October, but October was such a busy meeting. We just wanted to mention again, in case it didn't get touched on, we worked with Texas to implement some new software for our BEI testing to ensure an optimal testing process for our candidates. Next slide, please, Colleen. I know we touched a little bit on this morning. James mentioned about the survey that we're partnering with Innovy on, and there are 3 phases. The first phase, Michigan Health and Hospital Association funded. So we are in the midst of getting through our first phase and moving into our second phase with them to do the survey of the QI and then the deaf, blind, and hard of hearing community. The second and third phases, we received a grant from Michigan Health Endowment Fund. So that's exciting. That's been finalized. And then Innovy did release, and as well as us, we released an announcement just announcing the survey and what to expect coming up. And with that, I think our next step is an update from Innovy that they were unfortunately not able to be here today, either online or here, but they did record a recording for us. Did I jump ahead too far, Colleen? Sorry. Is that all right?
Hello, my name is Shane Feldman, CEO of Innovy Strategies. I'm excited to share an update with the Qualified Interpreter Board of Michigan and the Interpreter Needs Assessment Project. Our team is making progress, and I want to highlight a few key areas of our work. Our project team is currently in the process of designing some survey questions. We're actively engaging community members to gather feedback on the design and content of the survey. We're also reaching out to the community members to learn more about what should be prioritized in the initial needs assessment. It's important that this needs assessment includes a wide range of perspectives, including hearing interpreters, the deaf-blind community, deaf-blind interpreters, deaf interpreters, trilingual interpreters, all these different groups in the project. We're asking for them to be involved in the survey and to support the responses to those questions so that we can gather that information. Our data collection process will begin in a couple weeks and will include several different components. And there's email addresses to contact us as well, and Laura. So we hope to engage members of the Qualified Interpreter Board in this process.
Excellent. Since I jumped out of order, I'll give Colleen a minute to jump back to the slide I was on. I apologize. So as Shane mentioned, and it's really important that we get some community involvement. We're really hoping that we can get as many responses from QIs, the deaf, deafblind, and hard of hearing. They are going to be setting up some small work group. I think they call them focus groups before we release the survey to see how best can we reach the community, what are the best questions to ask. They also have a draft survey that questions that they just released to us recently. So we're going to go through those, and then they'll start working on some of those focus groups, and we'll be reaching out to partners and key people in the industry. Yeah, Mitch.
This is Mitch speaking. So I'm curious about Innovi and their recruitment, their strategy for the focus groups. How are they recruiting? How do they know, or how are they going to be contacting people to engage them into those focus groups? Can you explain that?
Yeah, that's a great question. So we provided them with several contacts, also contacts from the board to reach out. I know they have not quite yet done that. Let's see, several contacts, including Michigan Department of Education, civil rights, those that are in the industry that are kind of well-known. And then if in those focus groups, there's maybe another connection they should be making, we can make those recommendations. Does that help answer the question?
It does. But I also want to make sure that we're including, like, I don't know if we're calling them grassroots organizations, but really community people, community-based people. I mean, I know we have, at the government level, we have organizations, but it's important too that we involve the community. So MDA, deaf clubs. So maybe DAD, Detroit Association of the Deaf, Flint Association of the Deaf, Tri-City Association of the Deaf. Any other ones? I think that's all of the clubs. Because to me, that's vitally important that we don't overlook them in the community.
Yep.
This is Sarah speaking. I'd like to add to what Mitch has mentioned here regarding the Tri-County Association for the Deaf. They're often overlooked, but they are a club, and they're in the northern part of the state. So that area is certainly lacking interpreters. So we want to make sure that we include them as a remote representative in the community. So if you could add that to the list, I'd appreciate it.
Absolutely. I think those are great suggestions. We did include some of them, but a couple of them sound new to me. So definitely it's good to know those, and I think we're taking notes. So we'll make sure, if not, we'll reach out to you guys and get an inclusive list if we missed anything.
Thank you.
Other questions on that before I move forward?
This is Sarah. Nope, not on that, but yeah, I have nothing else on that.
All right. So, we really would like to engage the community. So getting people involved, we will be sending out, updates as we go. Our website will be updated and is updated with a video currently explaining the project, the introduction, and what to expect with the survey that's coming up. So we're hoping that'll be sometime this spring that we'll see the survey coming out, but that's hopeful. It could be early summer, but sometime in the next couple months. Yeah, James.
This is the James speaking. So you announced that, and the contact information, email address is there. For us who have already, we're already ingrained in interpreter organizations, deaf-blind, hard of hearing organizations. Can we now go ahead and disseminate that to our board members?
Are you referring to the, like, what part are you talking about inseminated? Disseminated?
The email that's mentioned up there, encouraging our organizations and our members to actively contact or be in contact with Innovi now.
Colleen, I'm sorry to put you on the spot. Have we heard either way from Innovi on that? I mean, this is public, so obviously it's out there already, but have we heard either way on that, Colleen, that
Well,
you're aware of?
I believe, this is Colleen speaking. So I believe this was part of the announcement that went out via listserv. So you can contact Innovi as far as I know.
Okay,
Thank you.
thanks,
question.
Colleen. Yeah, it is a good question. Thank you. April.
This is April speaking. On the next slide, it has a list of all of the people, interpreters, just that bullet pointed list of who they'd like to be involved in that survey. But I noticed something on social media on Facebook recently where one group was not represented there, and that is families of deaf children. So could we ask Innovi to kindly add that community representation to this list to gain some feedback from, please?
Absolutely. I think that's a great contact.
Thank you, Heather.
We may be reaching out to the board members on these, like the best contacts. So
Sure.
we appreciate the, the suggestions because I think this will help get more engagement.
Mhm.
Absolutely.
Okay, thank you.
I think we covered the slides that this slide, Colleen, we can move on to the next. Okay, so if there's no more questions on the survey, we'll be moving forward to draft rules. So as you know, we created preliminary work groups to draft the new rules. And that was a really great work group. We had a lot of good feedback and a lot of engagement. So now we're working on translating those into ASL before we do a public release of those. And I know that's a big project. So hanging in there on that and working through those, but we'll have more updates as we move forward and as we learn more on that. We did share the rules with civil rights and MDE to make sure that if they have feedback that we take that into consideration. And then as many of you know, just a reminder, if you were not able to attend on October 16th, we did have a town hall meeting regarding that, and you can find that on the website. Next slide. So from September 2023 to present, we've received 8 qualified interpreter complaints. These are just some statistics that, about what the section's doing. Our renewal applications processed, May through August of this last year during our heavy renewal season, about 642. And then one of the questions that's come up in the past is how many educational and substitute underqualified interpreters that we have. And it's for applications that we approved on that, we had 20. Likely there's more out there, but we know of 20. Mitch.
Go ahead, Mitch. So I have 2 questions or 2 comments, excuse me. The first one is so far complaints since September 2023, the number's 8. Do we have any inkling of what type of complaints those are and how they were resolved? Like what kind are they? I mean, was there discipline? Was there compliance? Was there, training that was required? Any indication?
That is a great question. I don't know all the answers to that. I know we've received complaints regarding healthcare, regarding training settings, things like that, most of which the AG's office has said is outside of our jurisdiction. However, we are working with civil rights to see is there some type of partnership or something that we can do to work together to ensure, communication efforts are being where they're supposed to be, that the qualified interpreters are in the correct settings and doing what they're supposed to be doing. So we are still exploring some of that, but from what we can tell, the ones we received were at this time outside of our jurisdiction.
I see. Okay. This is still Mitch. So just for my clarification and for the public as well, based on what, so you receive a complaint, but that complaint is more about failure to accommodate or provide access. And so that would fall under MDCR's purview, not under Lara's purview, because Lara's authority is if the person who showed up as the interpreter was qualified or not. That's where your purview is, correct?
So that's a great question. I don't have the complete, the best answer to that, I should say. I think we're still trying to figure out where, because we're getting maybe some conflicting information or information that just we're still figuring out. Like I said, that we've worked with the AG's office. We've also talked to Michigan Department of Civil Rights to see where these are, best falling. As many of you know, Annie moved on. So we have a meeting this next week, I believe, with them to meet the new person who was hired. So we're excited to continue looking into this and trying to figure out where best do these complaints fall. But at this time, from what we've been told, the complaints we've received are outside of our jurisdiction.
I see. Still Mitch. So I want to emphasize for the record, I guess formally for the record, since we're on the record, for me, enforcement is the top priority. So we've had rules for a long time, since 2014. But if there's no enforcement being done, there's no discipline, there's no type of penalties, then, the rules must be pretty weak. So that's my concern. If we had, is this your responsibility? Does this fall under you? Is this your authority? I would love to have that resolved because for us and for the community, because it's complex, right? People see, okay, the interpreters are under Lara. That means anything related to interpreting, I should file a complaint with Lara. Not the case. So I file a complaint with Lara and it gets referred somewhere else. That really muddies the waters for the community. And it's just very important for that to be a priority, which I know you know, but I would like to have it on the record. And then secondly, said about 20 requests for substitutes for underqualified EIPA educational interpreters. It says 20 have been approved so far. Is there any additional information about that or those 20? And the reason why, it was requested, who's being replaced? Is it the person has a BEI 1, or they have no certification, or they formerly had certification, or those schools are, way up north? Is there any more information to give us some context around those 20?
I don't think so. That's a good question. Colleen, am I correct? We don't have that data at this time.
This is Colleen speaking. Yeah, so that's a good question as well. We'd have to go back and do a deep dive in to make sure to give you the answers you're looking for. However, it's rare that we see someone with a BEI 1 that isn't underqualified, but it does happen. Yeah, most of them are, they aren't certified yet. They don't have the credentials. They are just getting in the door because they're interested in the educational aspect of it, or they've taken the EIPA, right? So, thank you.
This is Sarah. I've got to get something on the record, as you know. I'm choosing my words carefully. I just can't.
acceptable, and we should not be accepting that at all. No, I hold it dear to my heart, this is my son, this is my life. Absolutely not. I just want to put that.
Thank you, Sarah.
Okay, moving on to someone else if they would like.
Sorry, Mitch, if you don't mind, this is James. So, I mean, we agree. I mean, that data, we got to have that data, right? One big negative for us is your system. You know, how do you get the information? It's like paper. I mean, you fill it out with a piece of paper. That's the only way to get that in. Someone has to take the piece of paper, read the piece of paper, turn the page, put it in the system, read the next page of paper. I mean, that's how we're counting. I grieve for you. We need more information so that we can pull it up and see a waiver and have some basic information as to why, you know, you're still trying to get your EIPA certification. What is this asking for? What is it? I mean, we need for the EIPA score, there's just little information. And I know you recently, what do we get? $800,000 included in the budget, the budget, I mean, I know it's not like your money, but, it's not profit, but it's included in the budget. And again, for you to operate that funding to make improvements in the data collection, the data system, the analysis, so that we can convince those who maybe, we have a chance to get, more funding, or we can convince others to be effective and have some effective enforcement. Right now, I mean, thank you. We thank you for all the hard work and efforts all along. It's been a robust year and a half, that there's been a ton of stuff being done, and you've been collecting as much data as you could. But right now, at this time, I mean, it's a barrier. It's just a barrier. I mean, we can't, we can't drop our concerns and say, hey, we're working on it. I mean, that's just not, it's just not enough. I mean, plus without having the data to support, it's, I mean, we're both stuck. You're stuck. The board's stuck. The board's upset. You can't maybe give the specifics that we're looking for because you don't have them.
This is Sarah. I'm going to,
First, I know that I was not on mic. For the people on Zoom, they did not hear me last time. And I just want to say, absolutely not. No, we're not. We cannot allow our deaf children's education to be played with, not a moment longer, not a moment longer. Nobody is looking at these papers. I feel like you can just fill out a piece of paper and I got a waiver and that's it. Nobody is vetting this stuff. Nobody is looking to say, is this the right fit? Nothing. You're playing with deaf children's education. And that is a huge problem for me as a mother of a deaf child. Even though I chose to put my child in the deaf school, for that was our best choice, but there are other people who can't do that. And we're just putting anybody in there. It is our responsibility as Lara to make sure that there are qualified people that are helping to interpret and educate our children. That is a problem. And we can't just keep letting them just fill out a paper and say, we got a paper and there's only 20. I know there's more. And when we talk about enforcement, this is what I'm talking about. Who's checking? Or they're just waiting for somebody to say something. And there's parents who depend on the school system. The school system don't care enough. They just, I got it. I filled the spot. There's a warm body there and that's it. That's a problem, a huge problem. And we need to take care of that ASAP. Thank you.
Thank you, Sarah.
any other comments from the board?
Yeah, this is Mitch. I have a question about, when you receive that type of application, do you have any kind of, I don't know if it's, falls under the realm of your authority, but can you refer people? So you get one of those, and this says, well, they don't have the appropriate certification to interpret. Can you refer those people to MDE-LIO? Make sure that the school and the parents and the family know that that's not their only option, that there are other options. If so, because I feel very often what happens is, and maybe this is just a gut feel for me or from my experience, but my feeling is that the school and the parents don't really know that there's other options,
Mhm.
right? There are other options. So they feel like, well, the school's giving the paper to the parents, say, hey, we just can't find an interpreter, and your deaf son or your deaf daughter. I mean, if we don't use this person, they just will have nothing. So you need to sign this paper. Well, hey, the person signs, they were moving their hands around. They can probably interpret. So I just want to make sure that they can make an informed decision, right? So do we do anything like that? Is that a possibility? Can we refer them to other resources? Can we refer them to MDE-LIO if that's the right place? Can we do that?
Sure. So good questions. And agreed that, there's a lot that goes into this and what we're looking at. In a second, I'm going to defer to Colleen because she processes some, maybe not, as you say no, but I'm going to defer to her on how we process it at this time currently. But, I think we did address some of this in the rules a little bit. I don't think it's going to completely alleviate the problem. Absolutely not, especially, given the feedback that we've heard and today we've also heard. So, the rules are an opportunity for us to take a look at this process and, what can we do to change it? No?
Yeah, but it's already there though. I mean, it's already there. It's in the current rules. It's in the rules. It says you must consider MSD, Michigan School for the Deaf. You must. So it's documented, during the IEP process. It must be documented during the IEP process. It must be there. We as an IEP team, we decide that, yes, we feel that the best educational option for that particular child is to stay in a local district with an educational interpreter. Okay, we make that decision and then we search. We're supposed to find an appropriate qualified interpreter. Oh, we can't find one. Okay, we should go back to the IEP process. The IEP team should reconvene and then say, hey, I know we decided this is what we thought was the best option for that child to stay in the local district with a certified educational interpreter. However, we cannot find one. So we need to start that discussion again. So now, since we can't get a certified interpreter, do we still think that's the best option for that child? And my feeling is, and my gut is, and my experience tells me that that second meeting's not happening. Just saying. I could be wrong. I pray that I'm wrong. But I understand your point. And hopefully the new rules will maybe clarify and emphasize again. However, it's already in the rules.
Mm-hmm.
So it goes back to enforcement once again,
Mm-hmm.
you see. And so that's my comment.
Agreed. Go ahead, Sarah. Sorry.
This is Sarah. I'd like to add to that. I'm thinking that we need to, frame this in such a way that we're more proactive. We're spending a lot of time being reactive. We wait. We hope. We're looking for someone to file a complaint. Everybody complains about people, but we're not seeing those complaints filed. So we're hoping that people complain. So we are looking for individuals to be more proactive so that we don't have to wait to be reactive. That's just a thought as I'm going through this entire process.
I think that's a great comment and appreciate the feedback. I guess I have a question from our perspective. Is there some
Sure.
place that's doing this well? Is there another state that's doing better than us that we can look at or collaborate with? If you know of that, we'd love to hear the feedback and
Okay.
look at other models or other places that maybe have this figured out. So if there is anything, just keep that in the back of your mind and feel free to share with us if you know some solutions or others that have solutions.
Okay, this is Mitch. Thank you, Heather, for that point. We can do a survey and see if we can find another state that's doing enforcement well. Maybe we can actually not reinvent the wheel and copy their processes out there. Appreciate that point. This is April. I have a question regarding the September 2023 until now. You said you have 8 complaints, but 8, right? Nothing, you said that those are not under your purview. Are they statute of limitation issues? How can we figure out how to enforce the ones that are still valid, so that complaints don't have to be refiled and that they're not just stagnated and nothing's happening with them? Nothing is happening with those complaints.
And that's what we're trying to explore with Michigan Department of Civil Rights, and figure out where is the best place for these so that they're not having to be refiled, that we can either refer them to another area within the state, or who is the best place to address these if it's out based on the AG's response was outside of our jurisdiction. So we're trying to figure that out as well and working through the process. It did get a little bit slowed down with Annie moving on. So
sure.
hopefully we'll know more soon, but right at this point, that's kind of what we've been told.
Okay, so this is April again. So right now, you don't have a statute on time to actually file a complaint that hasn't expired, or?
So the complaints that we've received so far.
Right.
Right. If
Right.
it's outside of that person's control, then that wouldn't be held against them, obviously.
Okay.
And then there's, some of those 8, I believe the information we received afterwards kind of refuted what was being submitted to us. So
Okay.
we did in the beginning, when we started receiving complaints, try to look into them, do reviews. We requested responses and have done that for the 8 from the complainant and from the QI themselves. And so sometimes we learned new information that was able to help us to close those complaints out. So, but there were, a handful that after looking at them, we just said, this is what we're being told, that it's outside of our jurisdiction.
Okay, thank you, Heather.
Other questions on this slide? I thought this was going to be an easy slide.
Never. This is April. Go ahead. This is Sarah. Go ahead, Mitch.
Yeah, so I'm sorry, this just came to me though. What about nursing homes? What about hospitals? What about other professions under your purview? I mean, you have similar system, correct? Or do you? Do they have like a similar system where is the law structured, the licensure structured to be able to report and be reactive? Or excuse me, to be reactive? Is their system the same thing? Is it a reactive system? Or is it more of, hey, we had an audit? What's their complaint process like? Is it like our system, better than our system?
Right. So that's a great question. Depending on the facility type, there is, different safeguards put in place prior to a complaint occurring. They try to do everything they can to prevent those within the facility, the health facility. So there's steps in process. They have a quality assurance process. They do audits on themselves. They have other companies come in and do audits on themselves as well. So that's their, some of their pre-steps. And I'm sure that, probably some of our staff here could speak more to the complaint process as far as internal complaint process that is recent. But I don't want to put them on the spot. So, but there are steps in the hospital to, one, accept complaints, resolve complaints, looking at complaints from the facility side, if needed. Like I said, depending on the facility type, that complaint process, there is, steps internally. They also have an option to file with us. And so there's a complaint intake section that takes those complaints in. We review those complaints and determine, is this something within our jurisdiction, similar to what we have to do with our QI complaints? Is this something that we can look at? Is it under our rules? Is it under our laws? Is it under the regulations? Those types of things. And then if it is, that's when an investigation occurs, and there's a process for that that's similar to our QI process. Does that answer your question, Mitch? Okay.
I mean, I know we can only advise, right, BCHS, but I'm wondering if, can you have dialogue with MDE? And I mean, to me, specifically about education, talking about education, it seems like that could be easily identified. Students that have an IEP that use the specific rule number related to deaf students, right? I mean, could we not audit that type of thing? So that we maybe had a little better understanding of what's going on out there and what's happening. I mean, I don't know if there's any type of correlation or collaboration between BCHS and MDE. Is that possible?
Yeah, I think that's a great idea. When you're saying auditing, you're talking about with the underqualified interpreters as well as the students that may need interpreting services in the schools, like getting numbers on that. Is that what you mean?
Well, I mean, no, this is Mitch again. I mean, when a deaf student has an IEP and that IEP says that they're using an interpreter, can we do any type of follow-up on that? Even if we're just starting to get some, cursory information, some specifics, just doing some random calls, calling that school district and finding out, hey, we're trying to get some basic data on the situation with a deaf person there. Are you using the appropriate interpreter? Do you not have, are you not? Is there any reason why you're not? Is there any type of, I mean, I know we can't force them to give us the data, but I think that Larry already said something about, educate before enforcement, something like that. Right. So regulate, or was regulate, right? Was it regulate, Larry? Okay. So regulate. I mean, is there anything like that we can do? And, to James's point earlier, I think that the board does not want to, come up with some decision, invent something to try to tell you what to do without having the data. We have a lot of experience. We've seen it ourselves. However, I know that at the government level, we need data and we want to be able to support our decisions as well. So we need that. So hopefully I clarified what I meant about, collaborating with MDE.
Yeah, I mean, I think I'm getting, as far as what items that would be helpful for us to figure out. So like the number of students that are in the system, also if they're, using the underqualified interpreters, if they've tried other things, if they've had those second meetings, what type of efforts are they doing? We have collaborated with MDE, maybe not quite to this level. They have reviewed our new rules as well, and we received some feedback from them on that. So, but we can always circle back and see if there's something else that
Okay, great.
be better for us to, get more information to be informed and on that. And it might be something we can capture in a couple of the questions in our surveys. If we're going to include some of the groups that you guys mentioned, we may be able to get some of that information. If we are savvy with wording, we know we don't want to make the survey too long and people get survey burnout versus too short. So, but something we can think about for sure. Other comments?
All right. Thank you.
This is Miriam speaking. Thought about the survey and how we can, we have a list of, hearing interpreters, deaf interpreters, and the list goes on. Wondering if we can be proactive on reaching out to, say, the healthcare system or different systems across the state, the school system, the different counties, and just make the survey, and really get as much information as we can from what barriers they experience, anything that can help us compile data and really look at what issues need to be addressed, how deep, and so I really think just about the proactiveness of reaching out to organizations and to the different legal system, school system, and our healthcare system.
Yeah, I think that's a great suggestion. I also wonder if maybe a separate survey being done outside of the QA and then the deaf, blind, and hard of hearing survey for places like healthcare systems, schools, things like that, if that might be more effective to have it to be an independent survey to see what are the needs from the healthcare side or from the school side and see what some of the challenges are out there. But something definitely I made note of. Thank you for the feedback.
This is Sarah. Oh, okay, just making sure that I'm captured up on Zoom. Okay, wait. All right, I just wanted to make sure I was visible to everybody. Okay, so as Mitch said, it's really interesting because he pulls right from my brain. I feel sometimes we are literally connected to each other physically, so. But Mitch's delivery is so much nicer. Mitch, Sarah, feel that this issue with the Department of Education, the rules being done, written, passed, and there's still complacency. People don't care. So, education before regulation? I mean, how long does it take for departments to learn what they're supposed to do? Clearly, it's only an issue when they are confronted with a complaint. And if they actually get somewhere with discipline, perhaps that will send a message to everyone else involved that they need to get right with the rules and complete what they're supposed to do. I've had it. I'm tired of hearing educate the educators. They should know what they're supposed to be doing. They know what they're supposed to be doing. And we are back to the warm body syndrome. That's where we are because we want to educate before we regulate. No, we need to see something. We need to see some action. Sorry, I just had to put it out there. Thank you.
Thank you, Sarah. Other comments on the slide before I move on? I think all of this was great conversation and very helpful. So thank you for the feedback.
Thank you, Heather. This is Sarah. Thanks so much.
All right, moving on to test results. This is the one I always worry about, you guys, and then the last one. We continue to do testing. We did have a little slowdown in maybe September, October, and just with wrapping up some of our and maybe it was, I'm sorry, I shouldn't say so. We slowed down a little bit over the summer with doing renewals, but caught back up in September. So right now, with our BEI basic, we have about a 67% pass rate, which is, we've had 6 testers for that passed and 2 that failed, which I know is slightly up from what we've seen in the past, but still has some work to do. I do want to mention that we did reach out to Texas to see if they're going to be offering any more prep classes for BEI. So we haven't heard back from them. We're hopeful that they will. Last summer, they did offer it. And we also have explored talking with some of our testing groups coming up. I believe it's next week. We're meeting with them to see if there's any support that they can provide as well, either with testing or prep or something. So because we do recognize that these rates are pretty low. And then the BEI 2, only one person took it and did not pass, unfortunately. And then the BEI 3 or the master's level, 2 people took it and nobody passed. So that's where we're at right now. Questions on this, April?
This is April. I have 2. Are we still at about 90 days on the results? Is that where we're at still?
So,
Well, let me specify business days, 90 business days.
yeah, I would say we're about that, Colleen. Yes, no, about 90 days, maybe a little more. Less.
Colleen speaking. Yeah, we usually say 3 to 6 months, just in because we're not rating them. They're going to Texas, but lately, sometimes it's been a month. So it's been we feel since the pandemic times it's increased.
we're seeing
Thank you,
improvement overall.
Thank you. This is April Still. I have a second comment. So I'm putting on my educator's hat. I'm happy to mention that Texas, I'm happy that you mentioned Texas and hosting that BEI preparation training and making that available. And I know that ITP, I'll get a hold of other ITP directors, but here at LCC, we've been speaking to the person in Texas and we're hoping that collaboration is going to get worked out and we're going to host that training within LCC, specific to students at LCC. So I'm hoping that some of our other partner universities and colleges can take heed and follow suit and maybe do remote, some sort of training like what we're hoping to host. So, I mean, if we can host for the entire state for each ITP, and perhaps they host themselves, I'll further communicate with them. But I just want you to know that we're kind of on that track to getting that training hosted as well on our end.
Excellent. That's really exciting. Great to hear that that's
Yeah.
happening, that work's happening. Thank you.
Yeah, yeah, of course.
This is Mitch. So that 3 to 6 month to get the results back, I'm curious. So when somebody comes to BCHS, they take the test, do you immediately dispatch that to Texas, or do you wait until you get a few of them, 5 or 10, and then you send those on to Texas? Or
Yeah, so we typically have to batch them a little bit, but usually it's pretty quick turnaround on our end. They also have to be converted. There's kind of a, like everything else, right? There's a process. So Colleen and Heather do manually convert everything over for it to be in a format that Texas needs. And then when they get their rating team together, it sounds like they then do a group of ratings all at once. So that's why there's a bit of a delay. But we are testing for the most part weekly. So it doesn't take us long to get a batch, but you know, it just depending on the test level and what people are needing at that time.
okay, so this is Mitch speaking still. So meaning that the pressure point really is Texas and their rating and their process. So we can, get things turned around, converted, get it remitted to Texas within good time. We're not the lag in the system, right? We're getting it to them quickly, but because we're using them to evaluate and do the ratings, that's where the roadblock is.
For the most part, I mean, I don't want to say we don't have that. If we have one test, it's going to take a while for somebody to get a group with Texas to do one test. So not to say that we're not to blame for some of the lag. I would say maybe we're on the lower end of slowing down the process. But then once we get them back, then we have, we reach out to the candidates as quickly as possible and let everybody know what to expect, or what if they passed, failed, what they need to do. So I don't want to completely blame Texas, because there is some on our part, there's some responsibility on our part, but
Fair enough.
for the most part, getting that rating team together to rate those exams takes a little bit of time for them. But they have been improving, like Colleen said. We've really noticed. I actually was shocked at some of our January ones. Just their responses have been really good.
Okay. This is James. Just when I was looking, for the subcommittee report, doing some investigation, the Michigan BI test is not the only one, where there's a delay. It's other states as well that are waiting to get those, the national test and the EIPA test as well. There's delays in getting those results back. But it is interesting to maybe bring up to you, and maybe you can add to your website, that typically any announcement where the testing, process time is, they post that, we wait till this date and then we send out a report. So, I mean, it'd be easy to add that. You already have it set up on the website. You could add that, a banner, something, those of you are waiting, this is the time frame. you could look at the website and you could understand, what's going on, and you could adjust accordingly. I'll forward it to you.
Yeah, that would be great. I think that's a really good feedback. And I'm thinking of logistics behind the scenes. How do we, break down which has
Sure.
levels and who's, yeah. So to give accurate, because we don't want to misinform them also. So trying to find that balance, but I think that's a great idea. It's kind of making me think, like, what can we do to post that out there? So I like that.
This is Mitch speaking. So I'm curious to think about the TEP. I don't know if the TEP has any recent modifications or improvements or changes done to that, or if Texas plans to make any modifications to that, some updates, anything in the works to update the TEP that you know of?
Not to my knowledge. We've done some logistical updates to our tests to make them so they're easier to read, based on the feedback we've gotten from candidates. But as far as the actual questions themselves, I don't believe, right, Colleen? Okay. I don't believe that we've heard anything about them updating the TEP.
Okay, is that something that you can ask Texas about, please?
Sure.
So I'm a little bit concerned about, the age of the test. I just want to make sure that, it matches the language that we use today and the English that we use today. Secondly, another question. So I see, and maybe this just happened, but I see 6 people pass the TEP, 6 people passed the BEI 1, 4 did not. Oh, shoot. Thanks. Never mind. So 6 people passed the TEP, 4 people passed the BEI 1, and 2 failed. 4 plus 2 is 6. Is it the same 6?
Between the TEP and the BEI?
The BEI
BEI
1. So when I look at what the data you provided,
No.
I mean, do we know if those 6 people that took the BEI 1 are the same 6 that passed the TEP? And then 4 passed the BEI 1 and 2 failed. 6 and 6. Is it the same 6 people? Colleen, do you follow me? Yeah, no data.
I
no
see what
data.
you're saying. I don't think do we know if the 6 people that took the TEP are the same 6 that took the BEI 1? Like, did the TEP testers who did that in October? Probably not. It would be a fast turnaround time for them to do that. No. Okay.
This is Colleen speaking. I mean, that's a good question. I doubt it, but there's,
Just the
I'm looking at my
just-
colleague here. Yeah,
No.
no, yeah, more than likely it's not. Cause some people pass the TEP and then they don't sign up to take the BEI performance. We don't know why, maybe they decided. So we depth it, but it's good. It would have been a good correlation. Thank you.
This is April. Sarah, Chair recognizes April. I mean, we recommend that folks take their test. April, this is Janet, your interpreter. Could you restart your statement again? Thank you. Yeah, as a college program, I've got that hat on again. We recommend that folks take their test early after the TEP when they graduate, once they're ready to get their hands in there and get that test done and not wait. I mean, they can take the BEI 1, but once we want them in the door with the TEP to get that done, not hold off on that. And then if they need to hold off for the BEI 1, that's fine. Because those students sometimes are waiting. There's a huge gap between passing their English proficiency to when they take their skills test. Plus, those numbers, you still got 9 people waiting on results, right? If you look at these stats, so it's probably likely not the same 6. But to that point, when we're talking about data, do we have the authority to edit applicants, the actual application for the BEI? Can we actually use that information on the application? As a college, for example, we like to see what our graduates, what their success rates are. So can you ask an actual question? Did you graduate from an ITP? Can you add that to our application here in Michigan? Do you have the authority to edit that? Or does Texas regulate that?
So just so I understand, you're saying should we, or can we add the question, did you graduate from an ITP?
Yes, where, and if yes, where, for tracking purposes?
Sorry, I'm probably not making the connection. Help me to understand. So when we ask that question, that information will help us to better understand what portion of this process. Does that make sense?
Well, it would help, it would help my specific institution and all of the institutions, right?
Okay.
All the colleges can actually see that data collected by a third party. So we ask graduates, did you pass? Did you fail? We get a response sometimes we don't. We'll hear sometimes they'll self-initiate. I passed my exam, but if they didn't pass their exam, we might not hear from them. Possibly they've moved out of state or they've moved on. So for us as the programs, that helps gauge whether we're seeing a stagnation in our
Okay.
curriculum, if we need to make internal approaches to impact those results in a more positive manner.
Yeah, I think that's a great suggestion. We can look at adding that to our applications. And thank you for helping me connect the dots
Oh,
there.
It's my pleasure. I know it might not be a required question on the application, but perhaps it could be an optional. But yes, I graduated, but to even have more comprehensive of where, that would be very helpful. Thank you so much.
Made a note. Thank you. Other comments, questions on testing? I think, oh, do we have one more slide? Oh, just our normal contact information. I think that's all I have. James.
This is James. But I'm going to, if I can add something here. Thank you, Heather. I recognize that you are currently trying to work on a time frame for the next meetings and to perhaps move the agenda to the afternoon and have meetings in the afternoon instead of mornings. I do think that's critical because I do believe a lot of interpreters have reached out to us regarding time changes.
Excellent.
One thing I'd like to recognize, I might be stirring the pot here, but I'm going to throw this on the table. So the slide that you have that you just presented, there's some small print that says LARA protects people and promotes businesses. I think that's interesting. I just would like to emphasize they don't often cooperate, those two entities that you're identifying. Protecting people or promoting businesses usually happens in isolation. So promoting a business, for example, when you see, I mean, let me back up. The reason that I'm commenting about this is because of agencies. They feel an ethical responsibility to the community that they serve, deaf, blind, hard of hearing. That should be part of their agency wants and needs. But there are agencies from other states, as well in Michigan, that do not have that same business philosophy. But they certainly benefit, right? And there aren't repercussions for them if they don't. So there are agencies that are doing due diligence, working very, very much in line with the rules and regulations and being honest when they can't locate appropriate interpreters. They don't use a waiver. They're not doing backdoor deals, finding loopholes, any of that. They're not doing that. Those agencies feel undue burden, right? They're stuck between a rock and a hard place. They are trying ethically to follow the law and the law that they're supposed to, and their business may suffer as a result of it financially. And then there are other agencies that could give two dangs about it, right? They will do what they need to do for profit.
Mhm. Yeah, that's a good point. I understand what you're saying. Get it? Yeah. It's definitely a challenge. Yeah. But thank you for the feedback.
This is April, last thing, I promise. The last slide says that, still have available position. HR developer, is that position closed? When do we expect someone to be hired to fill that gap?
We're excited to say that we did interviews last week and the beginning of this week, so we're hoping to know soon who accepts and moving. Yeah, so hopefully we'll know soon, definitely by the next board meeting.
Thank you.
And well before that, most likely, but we'll have an update on that in the next board meeting.
This is Sarah. Thank you, Heather. I'd like to extend any other comments from the board at this time. This is Sarah. I'd like to say on behalf of the entire board, Heather, thank you for the department's work. I know that we can be highly motivated when we're speaking to you. The enforcement part that we've been talking about is something.
I'm ready for the
Ready.
enforcement team to work. And so I'm telling them that right now. I'm looking at you like, yeah, we ready to put you to work. So, with all of that said, thank you for your hard work, and we really appreciate, and we thank you so much.
Absolutely.
And we
thank
are going to take a break.
you. Thank you.
For I feel like our deaf-blind interpreters have really been working very hard over there. And so I say 15, please,
Okay.
15 minutes.
Thanks, Sarah.
This is Sarah. It is 11:43 a.m. We are going to reconvene the board meeting. Moving on our agenda. Now is the time for public comment. Now is the time for public comment.
We will first have in-person public comment, followed by anyone that has left comments via Zoom. We will begin with Lawson McNally.
Where should I stand? Can you guys all see me? Can I stand here or? If I'm over here, they're gonna have to sign for me. Oh, okay. Whoa, awkward. Here's half of me. I just want to thank everybody for allowing the public comment. Enjoyed this morning. Very happy to be here with BCHS and everyone who's here. Laura and comments made, Heather, your comments made related to the different topics. And yeah, a lot of this should have happened a long time ago. I know we're in process. Sarah, you mentioned it. My part is specifically health issues like hospitals, dentists, typically, they're colonized in some ways, right? They secure the same interpreter. I've experienced, and I'm like, oh man, that's enough. I'm tired. One example that really impacted me at the dentist, I had an appointment. You got to make an appointment 3, 4, 5 months out. I tell them I need an interpreter. My wife's deaf-blind. I need somebody who can. VRI is not going to work because she's deaf-blind. I explain all that. Yep, we will. So they appoint Voices for Health. I hate to name a place, but Voices for Health, that's who they're going to use. I'm like, whatever. We got 3 months. We get to the week of, sorry, we don't have an interpreter available. And my response to them on the phone is, I have to say the word baloney. That's it. Come on, it's baloney. Come on, it's baloney. And they like, well, yeah, that's what they told me. They told me to just contact this place. And I was like, no, you should have others that you can contact, other vendors, not just one. That goes out to just one entity. I said, no, you need to contact DEFCAN. You need to contact CAC. You need to contact all these other agencies as well, not just one, and then make the case that we just don't have enough interpreters. Here at Sparrow Hospital, here in Lansing, there's an interpreter there. One, that they have a contractor, then they contract with others, but it's a McLaren here. They won't. They say, nope, we're not having in-person interpreters, must have VRI, must use VRI. And in our situation, we can't do that. VRI is good for a short discussion. Deaf-blind cannot use VRI, period. And they're using me as a third party to relay that information to my wife. I'm family. So, I want BCHS, I want the board, Laura, to stop that. You must. Or just using one agency. They need to be contacting multiple agencies to secure an interpreter. If there's an interpreter available, great. You can't tell me we can't. That word's got to go. We need to get rid of that. And it's being used as a control mechanism, and nobody's following the rules. So I want to see some improvement there. And that's what a lot of deaf people coming in, a lot of deaf people don't file complaints because, for what? They come in, they tell you, they go, and they know it's like, I know what's going to happen. Same thing has happened to me too. It's normal out there. That's what's happening.
This is Heather Keel. Thank you for your public comment. Next, we have Erica Chapin with Deaf and Hard of Hearing Services.
Hello, this is Erica Chapin from Deaf and Hard of Hearing Services. I want to start by saying thank you to all of the board members as well as the BCHS staff for all of your hard work. It's been great to see productive conversation and items being addressed throughout the past years and seeing some progress. So thank you so much for that. I did want to make a comment about some of the things we heard today. So a lot of really good discussion about interpreters and education and as well as testing delays. And I know that EIPA here in Michigan and across the nation has extreme lag time in their testing grading. They have about 10 months to a year of wait time to see what your test grade is. And so I just want to propose maybe to Laura to see if you guys have any conversation with EIPA and Boys Town to see what their progress has been and what steps they're taking to reduce that lag time. I know a lot of the communication to the public has just been, this is the lag time and we're working on it, but there has not been any updates. And so a lot of our students are testing, a lot of our postgraduates are testing and waiting to get their results and waiting a year with no opportunity to improve, no knowledge of where they need to improve. And it's just, again, delaying the flow of interpreters, especially in a setting like education where we need qualified interpreters for our kids. So just want to propose that out there and see if Laura would be willing to talk with them and see what progress is being made. I also wanted to make comments about the deaf-blind endorsement. I know in the last meeting, we talked about rules changing and potentially changing deaf-blind endorsement to just be a requirement for CEUs for all licenses. And the way the system is now, they do have a label of deaf-blind endorsement on MOIS. I would love to see that system change and maybe label those who are tactile capable, because right now the deaf-blind endorsement does not mean that you're tactile capable. And when you're looking for interpreters for that need, which is continuing to grow in our community, you reach out and then you just get told, oh, I have deaf-blind endorsement, but not tactile capabilities. So if we can find a way to label on MOIS that they're open to tactile and able to do tactile, we'd love to see that. Thank you.
Thank you. Are there any more in-person comments at this time? Seeing none, I will turn things over to Marie to read any comments that were given over Zoom.
Hello, this is Marie speaking. We do have one raised hand, Elena Leo. I'm going to promote you to a panelist. Please turn your camera and begin speaking when ready.
Hello, hello all. Hi, this is Elena. Can everyone see me clearly? I just wanted to make sure that if I can get a thumbs up. Perfect. Interpreter, can you see me? Perfect. Okay, great. Hello, everyone. Happy January, right? It's a little late to tell you, but Happy New Year. If you have not met me in the past, my name is Elena Lally, and I work for the Division of Deaf, Deafblind, and Hard of Hearing. I love the government system with all these acronyms, don't you? I would like to take the time to let you know that we have a new director here at the division. Her name is Kenya Lowe. Interpreter, you got that? Unfortunately, Kenya could not be here today, and so she extends her apology. She had some conflicts with other requirements and could not attend this meeting, so she asked me to sit in her place. We do have a few items we'd like to briefly mention from the division end. On February 21st of 2025, we will have a DoD DBHH Advisory Council meeting, and that is going to be in Novi, Michigan at a library. I will send that information out. There'll be a press release out of our office, and check our Facebook page. There'll be a variety of ways to access that information. The division now is also excited to say that we have another job vacancy that we are extending our team. We have a departmental specialist position, and that position is open currently and closes on February 2nd, accepting applications currently. So we hopefully will start interviewing in the next few weeks for that. And I also do want to mention to Lara that you have a job position. I understand that you've already done interviews. Please do keep in mind that in order for us to collaborate successfully, our entire community, we need to have somebody, hopefully, that can represent our community in some way, shape, or fashion. I do not mean that if you have a person who's hearing who takes a position that they're not qualified, but there's so many other job qualifications that are out there. And we don't see that enough with our community. We don't have deaf, deafblind, or hard of hearing folks that are in some of these positions. And so often we only see these positions posted on a website, on a government website, and maybe a Facebook page that's for interpreters. So I'm hoping and encouraging individuals that are making those decisions to ensure that our community is not overlooked, and make sure that those opportunities are posted in areas on social media that we might otherwise miss. So I just wanted to make that comment. And also, for your next steps for planning your board meetings going forward, it took me 10 minutes this morning to find this Zoom link for this meeting that I'm on with you. It was quite a search. There were so many emails and a lot of information. I did flag it, but it was way back in my emails, right? So it took me a while to get to it. I went to your website, needed to scroll, and finally was able to find it. So just a note there. Imagine if I am struggling and I work in state government, what's happening with the community, especially deaf, hard of hearing, and deafblind folks getting access. I'm not the only one. I'm not speaking for the community, but I think it gives an example. And I also got some folks that contacted me this morning asking how to access this meeting. So I encourage you to disseminate your meetings, cast a wider net if you can, and encouraging people that they can join on Zoom and to make the meetings, continue to make the meetings as accessible as possible. I think that's all I have from the division end of things, and thank you so much for your time.
This is Marie. Thank you, Elena. I do not see any more hands raised. I will now read the comments submitted in our chat box. Oh, I see one hand raised. One moment.
We're sorry. Your conference is ending now. Please
They no
hang up.
longer have their hands raised. I have a comment from John Kirsch. Educational interpreters should also be added to the list of stakeholders. One moment. Again, we have another comment from Karen Marizek. My understanding is there's a difference between a waiver and an exception. This count only recognizes exceptions and not waivers. Waiver numbers are unknown. Also added, we go back to enforcement. Per the rules, all options are to be discussed for an exception. Who's making sure that happens? Also, again, waivers versus exceptions. We have another comment from Jay Paletti. Many schools are putting other reasons for IEP qualifications such as cognitive deficits so that schools do not have deaf as the primary disability to avoid having an interpreter at all. We have another comment from Angelic Taylor. DODDBHH addressed the turnaround time that it takes pertaining to once the test has been scheduled and taken, but what are they doing about processing applications, scheduling tests, and returning phone calls? We have another comment from Dylan Secord. I wanted to inquire whether BCHS is considering reinstating the use of local raters to evaluate BEI exams rather than relying solely on raters in Texas. In the past, DODDBHH was able to hire local raters and manage the evaluation process for all BEI exams. I strongly believe that bringing back this approach would help streamline the rating process and improve passing rates for our interpreters. I would appreciate any insights you can share on this matter. We have another comment from Jay Paletti. Needs someone from the DDBHH community to work within Lara. And we have another comment from Yakata. Detroit Black Deaf Advocates, DBDA, for sharing info to the DDBHH. With the draft rules changes, can we emphasize the who can request the waiver and making sure the parents, students, and patient, or all who are directly impacted, are aware and asked? There are no more additional comments at this time.
This is Sarah speaking. Thank you, members of the public, for your comments. Your comments have been heard and will be noted for further discussion. We've now moved to the point of our agenda for announcements today. Any announcements from the board? Oh, James, okay. I should have just said James, because I know you've got announcements. The chair recognizes James.
Thank you. So a community event for organizations is going to take up an event soon. There's 3. Michigan Registry of Interpreters for the Deaf going to be hosting a monthly meeting leading up to our spring business meeting Wednesday, February 12th. It's going to be in the evening. It's going to be virtual. Sunday, March 16th, also virtual. And then face-to-face meeting April 26th. And the location of that has not yet been determined for the in-person meeting. So we're going to work with some of the other deaf, blind, hard of hearing organizations to see where we can all get together and have that hosted. Michigan Deaf Association, they will be hosting a meet and greet here very soon. It's going to be actually this Saturday, February 1st at Lansing Community College in the Gannon Building. And that is going to be at 1 p.m. So we encourage everybody, get the word out, come, get to Lansing, hang out, mingle, support MDA. And then the Black Deaf Advocates of Detroit, they're going to be hosting a meeting on February 8th. The meeting time will be 12 o'clock until 3 in the afternoon. And then after that, from 3:30 to 5, there'll be a social event as well. Games, food, refreshments. And that's going to be at Madonna University. So again, February 8th in the afternoon. So we encourage our community members to remembers that, you know, individuals need to come and individuals who come to make complaints, you know, oh, okay. Individual complaints only have a minimal effect on things, right? They have a little bit of influence. When an organization gets together and steps up and makes a complaint, that has power. So, you know, how your organization, whether it's getting smaller, whether it's not as healthy, whether it is healthy, has a lot to do with our communities and has a big impact. So we encourage you to be involved in your organizations and take those actions. And this is Mitch speaking. I want to congratulate two people, Annie Uraski with her new position under MDCR, Michigan Department of Civil Rights. Congratulations, Annie. Also Kenya as well. Kenya Lowe in her new position as a director in the Division of Deaf, Blind, Hard of Hearing. Congratulations to both of those individuals. Look forward to continue working with them in their new positions.
This is Sarah. Well, you took the words right out of my mouth, Mitch. You are right here in my brain. April, Rowan, Miriam. This is Sarah as the chair and from this board. I'd like to echo that congratulations to Annie as the legislative liaison up at MDCR. And I'm very thrilled to see that Kenya Lowe has taken the reins over at the division. So we're very excited to see what's coming from those things. Thanks for your announcements, James. It's important that interpreters go to events. It's critical for you to be there, not just work. You need to be visible in the community. You need to socialize. This is how you build trust in the community, is by being visible, not only from a work perspective. So with that, this is Mitch. I motion to adjourn the meeting. Rowan has second. This is Sarah. Everyone in support. The meeting is adjourned. Thank you so much.